Hi, CAELIN, podiatrist with Holistic Foot Clinic. In this video we're going to be talking about warts. Plantar warts, otherwise known as verruca pedis or papillomas of the foot, are very common conditions that can happen to anyone at any age, but they are more common in children and those with a lower immune system. What causes the wart is actually a virus, and not many people realize this, known as the HPV or Human Papilloma Virus. You can catch it from anywhere. Could be a pool, could be a public place, could have just been on your skin all the time, and eventually, maybe when your immune system was lower from some other illness, it gets into your bloodstream. And it tends to pop up on the hands and even more often at the bottom of the feet. Some people can confuse this with a corn. A little trick that we like to do in clinic is to see if it hurts when you push on it or squeeze it. The general idea is if you squeeze it and it hurts, then it could be a wart. If you push on it, it's more likely to be a corn. But you know what? Really, either way can hurt either thing. Look-wise, you might notice that other than there being just a growth of tissue at a certain part of the foot, there might be a little cauliflower-like center to the body, or that the striations of the skin, like those on your fingerprint, tend to just disappear. This is also a very good indicator, visually, that a wart exists, including little dried blood spots in the center. Now, the top 3 tips that we have for dealing with these things. Number 1, whether it's a corn or a wart, we're going to be bringing it down with scalpel debridement. We need to get that dead skin out of there, get the lesion off your foot, and ideally even get a bit of the body's immune system going if we get closer to the skin. Another way that we get the skin to come out and the lesion to come down is to use what we call salicylic acid. Now, as podiatrists, we have a much higher percentage than is available over the counter at your chemist, and we can apply this in a controlled environment. And the third common way is what we call caustic, or a kind of burning agent. Everything we're doing is trying to stimulate the body to realize there's something wrong here and we need to get to it. So we can use something like a stick like this, known as silver nitrate, or a liquid nitrogen treatment. Little tips for at home is to just keep as dry as possible on your feet. Reduce moisture with breathable socks, and try and wear thongs if you can to prevent spreading of infection to your other foot, to other parts of your foot, and to those around you. With treatment in clinic, we can expect to see resolution within 3 to 5 visits on average. Sometimes it's as little as 2, sometimes it's as many as 6. If you leave it alone, you could be looking at a few months or a few years, or who knows, until your body eventually fights it off. If you think you might have a wart, contact your best podiatrist, and hopefully your local podiatrist will be us at Holistic Foot Clinic. Thank you.